My name is Dr. William, and I want to ask you something uncomfortable right now. If I sat across from you in my office today and told you that your body has been carrying a biological signal since the day you were born, one that quietly shapes how your heart ages, how your brain holds up under pressure, and statistically, what is most likely to take you down if you do not intervene, would you want to know what it is? Most people say yes. Then they spend the next 10 years ignoring exactly the information that could change the outcome. Here is what almost no one explains to you in a 12-minute office visit. You already have this data. It is written on a card in a drawer somewhere or on a hospital form from 30 years ago. It is your blood type, not in the way diet books use it, not in the way wellness influencers talk about it. I mean, in the way that peer reviewed epidemiological research covering hundreds of thousands of patients followed across multiple decades has shown us with increasing clarity that your ABO blood type leaves a measurable fingerprint on how your cardiovascular system ages, how your brain resists pressure, how your immune system behaves when it is under attack, and yes, statistically speaking, what is most likely to end your life if you do not step in early enough. Today, we are going through every blood type, O, A, B, and AB. And for each one, I am going to tell you something that most doctors never bring up in a routine checkup. Not because they are keeping secrets. There simply is not enough time in a 15-minute appointment to connect all of these dots for you. I am going to do that right now. But stay with me through the end of this video because there is a modifier that sits on top of every blood type, something beyond the letter on your card that significantly shifts your personal risk profile. Most people have never thought about it. I will get to that before we finish. Right now, before we go any further, do me one small favor. Drop a comment below and tell me your blood type. Is it O, A, B, or AB? I will be covering each one in this video, and knowing yours will make everything that follows far more relevant to you. Drop your age in the comments below. I read every single one. Now let us start with blood type A. I want you to lean in here because this is the blood type where the gap between what people know and what they should know is the largest. Type A emerged as human populations shifted toward agricultural life, denser settlements, more complex social environments, exposure to a wider range of infectious agents. The immune system adapted. Type A people develop aggressive, efficient immune responses, particularly against viral pathogens. In youth, that is a genuine biological advantage. But here is where the blood type story gets complicated because what protects you in your 30s and 40s begins to work against you in different ways after 60. Type A blood carries higher clotting activity. The platelets are stickier. The clotting proteins are more active. A landmark Harvard study that followed 89,500 adults over 20 years found that people with blood type A carry a 5% higher risk of coronary heart disease compared to people with blood type O. That number may sound modest, but here is why it is clinically significant specifically for blood type A. When that elevated platelet activity is combined with chronically elevated cortisol levels, the cumulative effect over decades is what turns a 5% statistical difference into an actual cardiovascular event. The risk is not just in the number, it is in how the biology of stress acts on that number every single day. Now, here is the part that most discussions miss entirely. The reason the risk is so significant is not only mechanical, it is hormonal. Type A, people maintain the highest baseline cortisol levels of all the blood types. Cortisol is your primary stress hormone, and in short bursts, it is useful. It sharpens focus, mobilizes glucose, prepares your body to meet a challenge. But when cortisol stays chronically elevated, week after week, month after month, it does something very specific to arterial health. It inflames and stiffens the endothelium, the thin lining inside your blood vessels. Think of it like the inside of a garden hose, slowly losing its flexibility and developing rough patches where debris starts to catch. Here is the mechanism that every type A man or woman watching this should understand. When the endothelium is inflamed and loses its elasticity, it becomes a surface that sticky platelets preferentially adhere to. The elevated clotting activity of type A blood and the chronic cortisol driven endothelial inflammation that is native to type A physiology are not two independent risk factors. They are a compounding cycle. Each one makes the other more dangerous. In practice, this means that for type A people, stress management is not a wellness preference. It is direct cardiovascular medicine. It belongs in the same category as blood pressure medications and cholesterol management because physiologically it acts on the same underlying pathway. If you are blood type A and over 55, getting your blood pressure checked every 6 months instead of annually is not excessive caution. It is appropriate clinical monitoring for your specific biology. Ask your doctor to include homocysteine on your next blood panel. Homocysteine is an amino acid that, at elevated levels, actively damages arterial walls. Type A, people tend to run higher homocysteine, and the intervention is surprisingly straightforward. Dark leafy greens, eggs, legumes, and lean proteins supply adequate folate, B12, and B6. Not expensive, not complicated, but specific to you. And establish a daily reset routine for your cortisol levels. Not a weekend retreat, not an occasional meditation session, something you do every single morning before the day pulls you in. Diaphragmatic breathing, 4 seconds in, 6 seconds out. Practice consistently for 10 minutes has measurable effects on cortisol regulation in clinical studies. Consistency matters far more than duration. 5 minutes every morning outperforms 1 hour on Sunday. Type A, remarkable immune strength, elevated cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated. Managing that hormone is the single most important health decision you will make this decade. Now, I want to pause here for a moment and give you something practical that goes beyond what we can cover in a single video. Everything I have walked you through so far, the cortisol connection for type A, the clotting activity, the specific tests to ask for, the daily habits that actually move the needle. This is the kind of information I spent years wishing I had time to put in front of my patients before they left the office. The Complete Senior Health Vault brings all of it together in one place. It is 3 plain English guides covering the medications worth questioning, how food functions as medicine after 60, and what your body is trying to tell you in your 70s and beyond. You will find the link in the description or just scan the code on screen right now. I want to finish by getting to the blood type information that most people never hear about, including a factor that sits on top of your blood type letter and changes everything about your risk profile. Stay with me. Let me tell you about someone I will call Margaret, 71, from Phoenix. She came into a practice I was consulting with, complaining of what she described as a low hum of exhaustion that never fully lifted. Her blood pressure was creeping up. She had been told for years that her labs were fine. She was type A. When her physician finally ran a full inflammatory panel, including homocysteine and cortisol patterns, the picture became clear. Her homocysteine was elevated, her cortisol was running high throughout the morning hours, and her endothelial health markers were showing early strain. None of this was a crisis, but all of it was pointing in the same direction. Within 8 months of targeted dietary changes and a structured morning breathing routine, her homocysteine had normalized, her blood pressure came down measurably, and she described sleeping through the night for the first time in years. The biology was never mysterious. It just needed someone to name it. Now let us talk about blood type O, and I want to frame it differently than you have probably heard before. Blood type O is the most common on Earth. About 45% of people carry it. And for most of human history, that probably represented an enormous survival advantage. Type O appears to have emerged in our earliest ancestral populations, shaped by environments that demanded physical resilience, a robust immune response to parasitic infections, and a digestive system capable of processing large amounts of animal protein under stress. Here's what that ancient pattern looks like inside a modern body after 60. On the cardiovascular side, type O people tend to carry lower circulating levels of von Willebrand factor, a protein involved in clotting. Think of von Willebrand factor like the sticky tape your blood uses to patch a breach in a vessel wall. Lower tape activity means smoother blood flow, less platelet clumping, and a statistically lower risk of the arterial blockages that cause heart attacks and ischemic strokes. Multiple large scale studies have confirmed that type O individuals carry a significantly lower risk of coronary artery disease compared to type A, B, and AB individuals combined. That is genuinely good news. But here is something almost no one tells older type O men and women, that cardiovascular advantage can become a psychological trap. In my own practice, I have watched this pattern play out more times than I can count. A type O patient comes in at 50 something, blood pressure is normal, cholesterol is manageable, no family history of heart disease, and because they feel structurally protected, they stop paying attention to the systems quietly eroding beneath the surface. They dismiss the fatigue. They shrug off the digestive complaints. They push through the joint discomfort because the most serious age-related vulnerabilities in type O people do not come from the heart. They come from below it. The stomach lining in type O individuals expresses surface receptors that the bacterium Helicobacter pylori frankly adheres to more easily than it does with any other blood type. Think of those receptors like door handles. Type O stomach walls have more of them, and H. pylori knows exactly which ones to grab. H. pylori infection is not dramatic. In most people, it does not announce itself with sharp pain. It moves in quietly, colonizes the stomach lining, and over years and decades gradually degrades the protective layer of the stomach. Left undetected, this drives a slow progression from chronic gastritis to peptic ulcers, and in a meaningful percentage of cases to gastric cancer. And gastric cancer caught at advanced stages is one of the hardest types of cancer to treat successfully. There is more type O people carry a notably elevated risk of certain peptic ulcer complications requiring surgical intervention compared to other blood types. This is documented. It is not a theory. So if you are blood type O over 55 and have never been tested for H. pylori, that is the most important conversation to have with your doctor this year. It is a simple stool antigen test or a breath test. It is inexpensive, and for type O individuals, this is not routine precaution. It is targeted prevention based on your specific biology. Your longevity protocol for type O. Your gut is your primary vulnerability. Protect it actively and consistently. This means limiting long-term use of anti-inflammatory medications like ibuprofen and aspirin unless medically necessary. These drugs erode the stomach lining in everyone. In type O people, they land on tissue that already carries elevated biological risk. Incorporate fermented foods into your regular diet. Kefir, miso, kimchi, naturally fermented pickles, not wellness accessories. For type O, these are practical tools for maintaining a gastric environment that is more resistant to bacterial colonization. Physically, your body is built for movement. Type O is associated with higher baseline catecholamine activity, which means your nervous system runs on more dopamine and norepinephrine than other blood types. Think of it like an engine that runs a little hotter at idle. When that energy has no physical outlet, it converts into restlessness, disrupted sleep, and over time, cortisol dysregulation. 30 minutes of daily walking and 2 resistance training sessions per week will do more for your long-term metabolic health than any combination of supplements. Type O, cardiovascular strength is your inheritance. Your stomach is your responsibility. Do not let the first make you complacent about the second. The code is still there on your screen. If anything in this video is making you think about conversations you have not had with your doctor yet, that vault is the place to take this further. Now let us move to blood type B. And this is the blood type that conventional medicine least understands, and that mainstream wellness culture treats most dismissively. Type B emerged among nomadic populations moving across the vast interior of Central Asia and the Himalayas. People constantly adapting to new food environments, new climates, new infectious pressures. The immune system that developed is genuinely remarkable for its metabolic flexibility. Type B people can efficiently process a wide range of proteins, fats, and carbohydrates without the inflammation that other blood types sometimes produce in response to dietary variation. That adaptability is real. But here is the clinical problem that most type B people over 55 are carrying without realizing it. Type B carries a distinct and not yet fully understood immune signaling profile. What research shows consistently is that type B individuals have a notably different gut microbiota composition, and that certain inflammatory dietary triggers, refined seed oils, ultra processed foods, high fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B people compared to other blood types. Think of it like this, where type O or type A gut might absorb the impact of a processed meal and recover relatively quickly, the type B system tends to stay in a slightly elevated inflammatory state longer after exposure. The autoimmune landscape across blood types is still under active study, and the findings are complex. What is clear is that keeping baseline inflammation low through diet, exercise, and regular C reactive protein monitoring CRP is the most evidence supported longevity protocol for type B individuals. CRP is a standard inflammatory marker available on a routine blood test. Keep an eye on it at least once a year. A consistent CRP reading above 1 milligram per liter with no obvious acute infection is a meaningful signal. It means your immune system is running in a state of chronic activation, and you need to find the trigger before it finds you. If you are type B and have been managing fatigue, joint pain, or unexplained systemic symptoms purely through lifestyle adjustments, attributing them to normal aging, it is worth speaking directly with your doctor about screening for autoimmune conditions. Early detection of autoimmune disease dramatically changes the treatment trajectory. These are not inevitabilities, they are detectable, and detection changes everything. On the exercise side, type B physiology responds better to sustained moderate intensity movement than to repeated bursts of high intensity. Cycling, swimming, hiking, and regular brisk walks protect your baseline inflammation level far better than interval training programs, which generate sharp spikes in inflammatory markers during recovery. Type B, the most metabolically adaptable blood type on the planet. Keeping the immune system well calibrated is one of your greatest biological assets. Left unmonitored, it becomes one of your most serious vulnerabilities. Tell me in the comments, have you ever been told you might have an autoimmune issue, or has it always been explained away as just getting older? I read every single one of those comments, and I am genuinely curious how often this goes unnoticed. Now, blood type AB, the youngest blood type in human history. AB appeared relatively recently in evolutionary terms when populations carrying type A and type B antigens began mixing at scale. And because of that dual inheritance, it carries a truly unusual immune profile. On one side, type AB inherited the immune tolerance tendencies of both parent types. Type AB people show lower inflammatory responses to certain environmental antigens, which translates into a meaningfully lower risk of some gastrointestinal cancers and certain gastric conditions compared to other blood types. That is a genuine advantage. But here's where I need you to pay close attention. Because what type AB gained in immune tolerance comes with a cost in neurological vulnerability that the research has made increasingly difficult to ignore. Type AB people carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O individuals. The mechanism is cerebrovascular. Type AB carries elevated clotting factors inherited from its A component, combined with the cardiovascular complexity of the AB antigen profile. Over decades, This produces subtle but cumulative changes in blood flow through the smallest vessels in the brain, the microvessels that feed the regions most responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages. These are microscopic, gradual shifts in perfusion efficiency through neural tissue that most people would never notice until the cumulative effect has been developing for 15 or 20 years. Think of it like the slow narrowing of a small irrigation channel feeding a garden. The plants do not die immediately. They just gradually receive less than they need, and the decline is almost invisible until the damage is significant. This is why, for type AB people, cardiovascular health and brain health are not two separate topics. They are identical. Blood pressure control, blood sugar management, cholesterol and triglyceride monitoring, every intervention that protects arterial health simultaneously protects cognitive longevity. DHA, the long chain omega 3 fatty acid found in fatty fish like salmon, sardines, and mackerel, incorporates directly into the cell membranes of neurons. It maintains membrane fluidity and reduces neuroinflammatory signaling that accelerates small vessel disease. For type AB individuals, 2 servings of fatty fish per week or a high quality fish oil supplement discussed with your doctor first is not optional supplementation. It is targeted neuroprotection based on your specific biology. Sleep is non negotiable. During deep sleep, the brain's lymphatic system, its internal waste clearance network, flushes out accumulated metabolic byproducts, including the amyloid proteins associated with neurodegeneration. Consistently sleeping fewer than 6 hours impairs this process significantly. For type AB people, chronic sleep restriction is not just fatigue. It is accelerating precisely the biological process that your blood type already makes you more vulnerable to. 7 to 8 hours every night, that is your most powerful daily intervention. Let me tell you about someone I will call Raymond, 76, from Portland. He came in during a consultation concerned about what he described as a slowness, not memory loss exactly, but a sense that his thinking had a slight lag to it that had not been there 5 years before. He was type AB. His blood pressure had been running in the high normal range for several years. His sleep was fragmented, rarely exceeding 5.5 hours. His diet was low in fatty fish. None of these individually would have alarmed anyone. Together, they formed a clear pattern. He and his physician restructured his approach. Strict blood pressure management, 2 below 120/80, 2 servings of fatty fish per week, a consistent sleep routine targeting 7.5 hours. At his follow-up 8 months later, he described the cognitive lag as essentially gone, and his blood pressure was consistently in the target range for the first time in years. His biology had not changed. His response to it had. Type AB, impressive immune tolerance, a brain that requires deliberate, consistent, long-term defense, beginning now, not at 70. Now, before I close, there is one more variable that almost no one includes in these conversations, and it matters. That plus or minus sign at the end of your blood type designation, Rh positive or Rh negative, about 85% of people are Rh positive, meaning they carry the Rh antigen on the surface of their red blood cells. The remaining 15% are Rh negative. This difference is not cosmetically insignificant. Rh negative people appear to carry a slightly different cytokine signaling profile, meaning the chemical language their immune system uses to communicate is calibrated differently. Research is still determining the full clinical significance of this. But what is emerging suggests that Rh negative individuals may have heightened sensitivity to certain inflammatory triggers. This means that regardless of the letter of your primary blood type, if you are Rh negative and you are living with any chronic inflammatory condition, the anti-inflammatory protocols I have described throughout this video are even more relevant to you and should be implemented with greater consistency for Rh negative women who who are pregnant or may become pregnant, particularly if your partner or baby may be Rh positive, please speak with your obstetrician directly and immediately. Rh incompatibility during pregnancy is fully manageable with appropriate medical intervention. It requires that intervention, and it requires it proactively. Know your complete blood type, the letter and the sign. Make sure your doctor has both on file. Now, here is the most important thing I am going to say today, and it is something that most blood type content avoids entirely. The statistics are real, the risk levels are documented, the biological mechanisms genuinely matter, but they do not determine your destination. In my 15 years of practice, I have watched type AB patients in their mid 70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was different, because they understood what their biology was working against and they organized their daily life around meeting it directly. They slept 8 hours, they ate fatty fish twice a week, they kept their blood pressure below 120/80 consistently, not just when they remembered. They continued learning genuinely new and challenging things, not passive scrolling, but real cognitive engagement. The risk was still present, the statistical profile still applied to them. They simply chose to face it directly rather than let it accumulate silently in the background. The gap between genetic predisposition and actual health outcome is not small, it is enormous, and it is filled entirely by decisions made consistently over years. That space belongs to you. Your blood type is not a sentence, it is a map, and a map is only useful if you are willing to look at it. Now, this video covers educational information only. It is not personalized medical advice, and it does not replace a conversation with your own physician. Never stop a medication on your own. Bring it to your doctor. Everything I have described here is meant to help you walk into that appointment better prepared, not to walk out of it. Drop your age in the comments and tell me which of these profiles matched what you have actually experienced in your own health over the last several years. I read every single one, and what this community brings up consistently shapes the topics I cover next. I made a video that explains the 3 most commonly overlooked causes of persistent fatigue and elevated blood pressure in men and women, over 55 conditions that are treatable when caught early and almost always mismanaged when they are not. I will put that video right here on the screen. Go watch that one.